This is part 2 of the chapter 39 lecture notes. And this is where we left off. We were going to discuss inhaling and exhaling. Okay, so what happens during an inhale or an inhalation is that the volume of the chest cavity or the thoracic cavity increases. And this happens due to two sets of muscles. First, the external intercostal muscles, which are intercostal means they're in between, basically in between the ribs. They contract and expand the rib cage. So that increases the volume inside the thoracic cavity. And the diaphragm, which is usually more like this, flattens out to more like you see in the picture. Okay, to more flat shape instead of a bell shape. So the diaphragm is the other muscle. So when it flattens out and the ribs expand, that whole area inside the chest cavity increases. That produces a negative pressure, which draws air into the lungs. Because basically what happens is the pressure of the air outside is high compared to the pressure inside the lungs. Now that you've increased the volume, the pressure is lower because volume and pressure have a inverse relationship. If you increase volume, then you decrease pressure. So the pressure in the lungs becomes low. The air from the atmosphere from outside your body is higher in pressure. So that causes it to enter the lungs. When we measure lung health, I guess you would say, lung function, we use tidal volume and vital capacity. Tidal volume is defined as the volume of air moving in and out of the lungs in a person at rest. So basically the volume of air that you inhale and exhale in one breath. And vital capacity is the maximum amount of air that can be blown out, that can be expired after a forceful inspiration. Now, oxygen enters our blood through the alveoli, through the air sacs in our lungs, but it travels through our blood by attaching to red blood cells. And specifically, oxygen attaches to hemoglobin, which is a protein, a globular protein on our red blood cells that contains 4 heme groups. And each heme group contains an iron atom. So you've got basically 4 iron atoms per, I'm looking at the picture and it's confusing, but 4 iron atoms per heme group. So each iron atom can bind 1 molecule of oxygen. So when hemoglobin is loaded with oxygen, it forms oxyhemoglobin. And then it travels through the bloodstream attached, of course, to the red blood cell. Hemoglobin's affinity for oxygen is, how attracted it is to the oxygen, how likely it is going to be to attach to the oxygen and carry it. It's affected by pH, and it's also affected by temperature. The pH effect is known as the Bohr shift. And basically when carbon dioxide levels are increased in your blood, that also increases the hydrogen ion concentration, which lowers the pH. And lowering the pH lowers hemoglobin's affinity for oxygen. So increased carbon dioxide in the blood lowers the pH, which reduces hemoglobin's affinity for oxygen. And that's a good thing because that causes hemoglobin to unload the oxygen into the tissue. So what that actually means is if the levels of CO2 are high, then we need oxygen because oxygen is low. So the hemoglobin lets go of the oxygen. And it does that because high levels of carbon dioxide lower the pH, and that reduces the hemoglobin's affinity for oxygen so that it will let go of it. And increasing temperature has a similar effect. Increasing temperature will reduce hemoglobin's affinity for oxygen, and it will release oxygen into the tissues. So HB-O2 is oxyhemoglobin. That's the shortened way of writing oxyhemoglobin. So the the curve here is measuring partial pressure of oxygen as compared with percent saturation of hemoglobin. So if the partial pressure of oxygen is 100%, hemoglobin is 100% saturated with oxygen. If you go down to 80%, when you go to the doctor and they measure your oxygen by putting it's just a little thing that they put on your index finger. So they're measuring the oxygen in your blood. And so if your oxygen goes down to 80%, then the blood hemoglobin's affinity for oxygen is a little bit above 80%. If your oxygen goes down to 20%, then hemoglobin's affinity is somewhere around that same mark. Um, if your oxygen is 30%, here's another one to look at. And in this part of the curve, the oxygen is lower and the affinity for hemoglobin is higher. So hemoglobin is 60% when the oxygen concentration is 30% or partial pressure is 30. It's not percent. I'm sorry. I keep saying percent. It's partial pressure of oxygen. So this when this curve shifts to the left, that means there's lower carbon dioxide at higher pH or lower temperature. That will shift the curve to the left. And that will cause the same value, the same percent hemoglobin at only a partial pressure of 20 rather than a partial pressure of 30. So partial pressure of 40, when it shifts right, will give you that same percent saturation. So shifting the curve right happens with higher CO2, lower pH, and higher temperatures. So in other words, shifting the curve to the right reduces hemoglobin's affinity for oxygen, and shifting the curve to the left increases hemoglobin's affinity for oxygen. And these three situations can do that. Higher carbon dioxide, lower pH, and higher temperature can reduce the affinity for oxygen and shift the curve to the right. And then lower CO2, higher pH, and lower temperature can increase the oxygen affinity and shift the curve to the left. Then as far as, okay, we talked about oxygen is transported on hemoglobin. Carbon dioxide is transported three different ways. About 8% is actually dissolved in the plasma. Not much, because that makes carbon dioxide dissolved in a fluid is carbonation, like in our drinks or in seltzer water, something like that. So we don't want that in our blood plasma. So there's not a whole lot of carbon dioxide dissolved in our plasma. 20% of the carbon dioxide is actually attached to hemoglobin, not to the same part that the oxygen is attached to, but it's attached to hemoglobin. But 72%, most of the carbon dioxide is converted to bicarbonate. And you can see the chemical reaction here. When carbon dioxide and water react, they form carbonic acid, H2CO3, which immediately breaks up into bicarbonate and hydrogen. So most carbon dioxide travels in the blood as bicarbonate. And then when it reaches the alveoli of the lungs, the reaction reverses. The bicarbonate reverses and forms into carbonic acid and back into carbon dioxide gas, and that is enters our alveoli, diffuses into our alveoli, and we breathe it out. Okay, so a couple of terms involving lung function. Hypoventilation is low breathing, insufficient breathing, and it occurs when the blood has abnormally high partial pressure of CO2. And hyperventilation is excessive breathing, and that occurs when the blood has abnormally low partial pressure of CO2. We have neurons that are very sensitive to blood partial pressure of CO2 changes. Um, so a rise in partial pressure of CO2 causes increased production of carbonic acid, which lowers high carbon dioxide, low pH. And then that stimulates the sensors in the aortic and carotid body, bodies that are in the aorta and the carotid artery. And that sends impulses to the respiratory control center. And I can't remember if it's the pons or the medulla oblongata, but that increases the rate of breathing. It causes you to breathe. So this, no matter if you tried to hold your breath forever, your carbon dioxide will eventually rise and your brain will cause you to breathe. Or if you pass out holding your breath, your brain will eventually tell your lungs to breathe again. So the brain also contains chemoreceptors that are sensitive to pH changes in the CSF, cerebrospinal fluid. So when that pH is low, the brain will cause you to breathe faster. Okay, and respiratory diseases, I'm sure you've heard of COPD, chronic obstructive pulmonary disease, and that's really a general disorder, any disorder that obstructs airflow on a long-term basis. Chronic just means it's a long-term disease. Asthma is caused by an allergen that triggers the release of histamine, and histamine causes constriction of the bronchi, which causes breathing to become difficult. Sometimes a person can suffocate. Emphysema occurs when the walls of the alveoli break down and the lung has fewer alveoli, but they're larger. So what that does is it decreases the surface area for the exchange of gases. Another thing with emphysema is the lungs become less elastic. 80 to 90% of emphysema deaths are caused by cigarette smoking. Then there is lung cancer, and this is a picture of a lung, a cancerous lung. That lung cancer accounts for more deaths than any other cancer. You may know that. And primarily what causes cigarette smoking is, what causes lung cancer is cigarette smoking. Now, I know that you hear people say, I had a grandmother who died of lung cancer and she never smoked a day in her life. Or I know someone who never smoked, no one in their house smoked, and they got lung cancer and died. These are definitely the exception rather than the rule. These are is much more common statistically for someone who smokes cigarettes to get lung cancer. Lung cancer spreads very fast, so that by the time it's diagnosed, it has usually metastasized or spread. And the statistics are really low. There are two types of lung cancer. Only one is mentioned here. I mean, it just says it like lung cancer is lung cancer, but there's small cell and non-small cell lung cancer, and the statistics are different with each one. Small cell lung cancer has less of a chance of surviving, but 3% of patients survive for 5 years after diagnosis. That means 97% don't.